Greetings from Body Scalp. This is Dr. Vikram from Chandigarh speaking to you concerning nose job today. Nose job or rhinoplasty is a surgery done for improvement in shape as well as breathing problems of the patients. And the shape can be improved in terms of a dorsal hump, maybe a saddle nose, maybe a broad nose, maybe a tip plasty which needs to be done, maybe some sort of crooked nose or S-shaped deformity in the cartilage. The problem can arise post-traumatic, it can be congenital, it could be purely for cosmetic reasons, or could be after some surgery as well. Once we've diagnosed exactly what is the problem, we've taken the photographs of the patients and we've discussed the problem with the patient on photographs as well as in the mirror. We plan out our strategy for rhinoplasty, and then after making sure the patient is fit for a surgery, we perform it. We call the patient in the morning, and I prefer doing it in general anesthesia so that my concentration is completely towards the job and the result, and the patient is not uncomfortable at all. Once in the OT, the patient is anesthetized. We do our markings, we plan out according to our previous made plan, and then after the surgery has been completed, the nose is packed with the dressing, a plaster is applied, and the patient is moved to the recovery room. If the anesthetist feels the patient is good enough, fit enough to go home on the same day, we discharge him. Otherwise, we keep the patient for another couple of days. Once we've removed the dressing, we send them home. A small dressing might be there for 5 to 6 days. Most of the sutures or scars, they are inside the nose with this very small scar on the columella, which is hardly a few millimeters broad and is not visible after 6 months of the surgery. The nose takes around 2 weeks to 6 months for the edema to go away. The swelling which occurs after surgery, that goes away within this time frame. The plaster, which is quite trendy and hep, is given to the patient for 2 weeks, 24 hours, depending on what job has been done, and sometimes for another couple of weeks to be worn at night in case we feel the bones are still not strongly united enough. We can combine this surgery with many other small surgeries like dimple creation, or maybe with liposuction or gynecomastia surgery, or maybe Botox and fillers, sometimes also with hair transplant in the same vacation the patient has come to us with. Many patients travel to our center from abroad, from US, from Canada, from Australia, from Europe, from Dubai, for getting their nose corrected, making it more beautiful. And let me tell you, they are all very happy after this. The complications are minimal. They are all handleable with maybe some non-operative, some medications, and some maybe physiotherapy measures, some massages, and they are hardly, if any. The tourism is increasing these days towards India for such jobs, especially all sorts of cosmetic surgery. The reason being, we are giving them very good results with least complications and maybe 1/10 of the rates at which they are able to get this surgery done in the Western countries. The stay in the hotel, the roaming about, enjoyment in the surrounding areas can all be arranged. You can arrange it through my website, which is scrolling down, or even give me a ring, and I'll be more than happy with my team to help you with the stay and roaming about during your stay and making it more comfortable. Any questions you have concerning rhinoplasty or any sort of cosmetic surgery per se can be asked directly to me or even emailed to me. I'll be happy to answer them. Thank you so much. This is Dr. Vikram from Chandigarh.